Hello, my name is Juan Colon, and I'm going to be talking to you guys about, I'm going to talking to you about bupropion for my psychotropic report project. First, I'm going to start with the case example. Again, this case is fake, so everything that is used here is either de-identified or, it's made up, including the name of the patient. So the patient's name is Carlos Herrera. Carlos is a 19-year-old male. He's a first generation college student attending a private university in Southern California. He is the eldest son of a Mexican immigrant mother and a Puerto Rican father. Both parents completed high school, but they did not attend college. He excelled academically in high school and he received a scholarship to study pre-medicine and he hopes to become a physician. He lives at home with his parents and he commutes to school. His commute usually goes from 30 minutes to 45 minutes. He has a part-time job to help pay for school, and he attends and is involved in a Latino Pentecostal church. So, major pathology issues. Over the past semester, Carlos took two exams, one in chemistry and one in biology, and he did not do well. This really shook him up and really caused him to kind of get into follow into this type of depression. He developed symptoms of depression. Again, he went to high school and he did very well with school. He never had bad grades. He always was A student, 4.0 student and above, and this really shook him up. Um, so the symptoms include loss of interest in activities that he once enjoyed, difficulty concentrating on his studies. For example, Carlos used to love playing soccer, and as a pastime, and now he doesn't have the energy to go and play soccer because his studies have overtaken. He has difficulty concentrating on his studies. He has trouble sleeping, waking up early, and not being able to fall back to sleep. And he has this, he developed this feeling of worthlessness and guilt, especially about not meeting his family's expectations as he's struggling academically for the first time. His appetite has increased and he has gained weight and he experiences fatigue and headaches. And again, this contributes to him not being able to go out and play soccer and exercise. He is reluctant to seek help because of the stigma regarding mental health in the Latino community, and he came to seek support after being encouraged by a trusted professor. Physical issues that he has been experiencing include sleep disturbance, fatigue, headaches, weight gain, and he has impaired concentration and motivation. He doesn't, he's always tired, and he just doesn't know what's going on. Some cultural issues that are happening here is that in the Latino community, there's a stigma in mental health where, and it's in a negative stigma, right? Where he's worried that he's perceived as weak and emasculated, but talking about feelings and emotions and seeking help, right? He is the oldest of in his family, and he also has so he automatically carries that responsibility and expectations of being the oldest, um, especially if he's coming from an immigrant family, first generation. If his parents didn't go to school, he carries that expectations of he has to go to school, he has to earn the grades, he has to get a high degree, such as becoming a doctor, a lawyer, an engineer. Um, and not only that, he also has that expectation of also taking care of his siblings because his parents work and has to be helpful at home, which can also be very stressful. So not only is he stressed about school, but he's also stressed about um, trying to honor his parents for all the sacrifices that they did care for his siblings, and he even has his own job, so he has to worry about that, right? Because he doesn't come from a family with a lot of income. He has to find ways to provide for his own gas to school, books, and all the supplies and materials that he needs for school. Spiritual issues. He is a Christian Latino he goes to a Christian Latino Pentecostal church, and he is very involved. He is hesitant to discuss his mental health struggles with his parents or trusted church leaders because he fears that he will be judged as not having enough faith or not being spiritual enough. Again, this is very common in the Latino community when it comes, especially when it comes to church. We're often taught that, if we're experiencing depression, anxiety, or some type of mental health, that we need to pray about it and just leave it up to God. And like if we're dealing with these issues, it's because we're in sin or something's not right. We don't have enough faith. We don't have enough trust in God. And which is, I think, can be very hurtful and detrimental instead of especially if the leaders in the church are not emotionally intelligent and they themselves are not educated on feelings and expressing how they feel, and if they're not seeking their own treatment, right? If they're not seeking their own help, and this can be cause a very toxic environment that can be very detrimental to people, to the attendees, which can cause a lot of issues. So as Carlos came to me, the treatment that I would recommend for Carlos would be giving him medication, a low dose of medication on bupropion or Wellbutrin, as an antidepressant. This can help him out. So I'm gonna go into talking about bupropion and Wellbutrin. Um, So, bupropion is an antidepressant. It helps stop smoking, which was introduced for smoking cessation in 1997. It was first patented by Burroughs Wellcome, now part of the GlaxoSmithKline, in 1974. It was approved by the FDA in 1985, and the brand name for bupropion is Wellbutrin. The sustained release, or the SR formula, was introduced in 1996. The extended release, or the XR formula, was introduced in 2003. Until 2000, the drug was referred to as amphetamine. The current use is the average use daily dosage range is 150 to 300 milligrams. The drug half-life is approximately 10% of the drug is excreted through feces, 80% of it is excreted through urine. The distribution half-life is 3 to 4 hours, and the elimination half-life of bupropion is approximately 21 hours. For major depressive disorder, if you use the immediate release, the treatment is initiated at 100 milligrams every 12 hours. This is increased to about 100 milligrams to every 8 hours on day 4, depending on what the provider states. If the therapeutic goals are not met on the 100 milligrams after several weeks, then the dose of 150 can be increased. The sustained release treatment is initiated at 150. The clinicians can consider increasing the dose um, if the therapeutic goals are unmet for after the 150, then they can increase it to 200 milligrams. And the extended release, it's initiated at 150. Clinicians can increase again the dose to 300 once daily. If there's no improvement after the dosage, then it can increase to 450. But maintenance with all of the formulations, they require several months or longer beyond the initial response, and patients should be assessed periodically to determine the need of the dose for the maintenance. Some common side effects, which usually diminish or but they may require attention if they if the side effect continues. This includes blurred vision, constipation, diarrhea, dizziness, dry mouth, hand tremors, increased appetite, nausea, sexual dysfunction, weight gain, anxiety, and insomnia. Some contraindications: patients who are hypersensitive or allergic to bupropion should not use the medication. It is contraindicated for patients with a seizure. Patients taking monoamine oxidase inhibitors, linezolid, or methylene blue should not take bupropion. Patients with a history of bulimia or anorexia nervosa. Bupropion has an FDA-issued box warning related to suicidal thoughts and behavior in children, adolescents, and young adults. All patients who have depressive symptoms and begin a new medication should be monitored closely for suicidal signs. So, additional treatment that could be important for Carlos, besides the bupropion, is psychoeducation, cognitive behavioral therapy, and spiritual and community resources. Providing Carlos with culturally relevant education about depression can help reduce the stigma and increase understanding and encourage engagement in the treatment. Tools like fotonovelas, comic book style pamphlets, or English or Spanish, in English or in Spanish, have been shown to decrease stigma and improve knowledge about depression in Latino communities. These interventions can be delivered individually or with family involvement, which may be especially important for Carlos, given the central role of family in Latino culture. And in order, to get family involved, psychoeducation would be very important just to educate the parents on what mental health is and how it can be beneficial if it's treated and attended to regularly. Cognitive behavioral therapy is the most widely studied and effective psychotherapy for depression among Latinos. It focuses on identifying and changing negative thought patterns and behaviors. Culturally adapted CBT, possibly it could be delivered in Spanish or or in English. It doesn't matter, but with sensitivity to Carlos's cultural values, and it can improve engagement and outcomes. And the spiritual and community resources, encouraging Carlos to draw on his spiritual beliefs and community resources such as um, campus Latino organizations or faith-based groups that can provide additional support and resilience. Um, if he's not able to reach that at his own church, the spiritual and community resources, maybe his therapist can provide him with those resources as well. And these are my references, and this is a little bit about what the medication bupropion is and how it could benefit Carlos as he is going through this new phase of life of college and dealing with all these um, issues or adjustments in his life. Thank you for listening.